digital pictures can be an important source of information if we are able to spot out this information and transfer it through the workout of the materials all the way down to a finished medical dental device. In this first pic, there could be so many elements to take in consideration. But the first thing that appears so evident is this A2 shade tab, which belongs to a Vita shade tab, next to this existing bridge, followed with this A2 Vita shade tab. I did get another picture, which is this here. It's a D2 shade tab, and this picture does kind of seem to be a little bit more blurry, out of focus compared to the one we were referring before with the A2. But out of this situation, we still can take some good advice for how we're going to be working with our shades and our colors. So here we have both pictures. I have Swift in 180 degrees this picture to compare the two shade tabs into the oral contest. Okay, so let's give a closer look to the situation, especially how the two shade tabs compare with each other. It seems to be evident that the value of the D2 seems to be lower compared to the value of an A2, and this is not just a matter of how the light is absorbed or is reflecting the case. Compared to the antagonist, I do like the way this lower value of the D2 does integrate with the natural teeth. Now this is a case a little bit particular because we have on the side an existing bridge, and we do have some teeth that are not exactly A2 or D2 on the lower. Always the same case taken from another spot. It's very interesting because this is exactly where the bridge will be located in the future once we have realized it. And I can see very well the antagonist, how it's done. From this angle, I did not receive a picture of the shade tabs into place, but we can take care of that. With PC and a computer, you can do anything with any program nowadays. We can bring in the two shades that we had before, and this is our D2 and here's our A2, and this way I can see how my D does match well with my canine, and my A2, I suppose that the doctor has chosen this color because he wants to keep harmony with the existing bridge color. So I can also rotate this image here. Here we go. Okay, and put it right next to, look at this lateral, how it matches well with the D2, and I guess this A2 here does match the existing bridge. So I guess the evaluation of these colors have been done with the premises that I have just pointed out to you. Mapping is a technique which is necessary for me, especially when I do work with doctors that are far away from my dental lab and do ship in their cases to be realized, and sometimes they are hundreds and hundreds of miles away from my city. So the only information I can get, is by mail, by email, and whatever I get with the case. So mapping is a personal technique that I came up with for detecting in which areas of the teeth the color is distributed and with what intensity it appears in those areas. So let's get back a minute to this, to how we magnify those two premolars, and let's try to understand how we get on with this technique. Now, mapping is like just a map. Matter of fact, you see, after I have magnified the two premolars, I have separated the body colors from the enamel. And even the body where there's more intensity, like in these areas, I have separated them as well. Besides giving a map of the body compared to the enamel, also the enamel itself is being mapped, because there are areas of darker enamels like these two lobos here and these lobos, and even back here this lingual cuspid of this molar is quite dark, but it's also affected by the inside shadow of the mouth. But you see, through the mapping, I am able to already print in my mind how colors and shades need to be located and collocated during the build-up phase of the job. I will proceed with mapping these 4 units down here, and I will do so even if our upper bridge from premolar back to the molar will be a different color, as we've seen on the shades, compared to these two premolars and to this molar. But the mapping is necessary anyway, because even if shade will be lighter, doing so and applying a difference of chroma intensity in the body, or a different values over the enamels of these units, will anyway come out with a more tridimensional and a more natural tooth, compared to just going in with some simple 2-layer porcelain buildup. So in this case, by drawing and contouring from the gingival attachment to the crown up to where I see the body color blend in with the enamels, I do draw with a program like Paint and delimit these two areas and divide the enamels from the body with just, a program of drawing. And in this case, it's simple as that. This has been done and now applied. So you see that here we have the body divided from the enamels, and the body itself divided into where we have more chroma and more richness of color. The same is done for the enamels. I will contour from the tip of the occlusion cuspids all the way and divide the enamels where they seem to be with less value compared to a higher value for their areas. So at this point I have the whole antagonist being mapped, and this is my mapping techniques, and this is the first stage of mapping, and we can go it and bring it even a further step away from where it is right now.